Hello, everyone. Thank you so much for joining us for today's webinar, How Sinai Chicago and Cottage Health are transforming 340B dollars into community impact. Before we begin, I'll walk us through a few quick housekeeping instructions. We'll begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. If at any time you have issues with your audio or visual, just try refreshing your browser. You can also submit any technical questions you have into the Q&A box. We are here to help. And with that, I am pleased to pass things over to Allison Aran to get us started.
Chloe, thank you. Good morning and good afternoon to everyone. Thanks so much for joining us. It's wonderful to have you here. I am Allison Aran. I am Senior Vice President at Clearway Health, and we are incredibly honored and grateful to have two of our client partners joining us for the conversation today. Clearway Health supports hospitals and health systems across the country to build and transform their specialty pharmacy programs. And we were born out of a safety net academic medical center that faces their own opportunities and challenges with both 340B and specialty pharmacy. And so as a legacy and subsidiary of Boston Medical Center Health System, truly honored to get to do the work that we do across the country with organizations like Cottage Health and Sinai Chicago. And so we are really grateful today to have folks joining us. We have Samir Shah, who is the president of Mount Sinai Hospital at Sinai Chicago in Chicago, Illinois. We have Scott Wester, president and CEO from Cottage Health in Santa Barbara, California, and Brandon Newman, who is chief executive officer of Clearway Health. And so to all of you, thank you and welcome. I'm really excited about today's conversation and the insights that you will share. And so with that, let's get started. We're going to go through and really have a great discussion. And we're going to start with getting to know a little bit about these organizations and the work that they do. Scott, we're going to come to you first for this question. How does Cottage Health maintain care equity for marginalized, low income, and uninsured communities?
Well, thank you, Allison, and thank you for the invitation to spend some time with you and Samir and the team at Clearway, as well as all the panelists. And a little bit about Cottage Health. Cottage Health is in Santa Barbara, California, which a lot of people would indicate, well, one of the wealthiest areas of the United States. It's also probably one of the poorest areas across the state of California and around the country. And we are the only independent community health system serving much of the California Central Coast. So think between LA and San Francisco. We're the large academic center between those two large metropolitan areas. And being 135 years old within our organization, we truly believe our responsibility is to care for everyone who comes through our doors, regardless of their ability to pay. We do not have a safety net county facility. We are the safety net facility. And about 25% plus of our patients are underinsured. So we invest in services that many organizations would traditionally not offer. And again, without our county hospitals, we are the community's provider of care. We work extremely closely with a few of our federally qualified health centers and other community partners to connect our patients with needed medication and services, especially within the specialty pharmacy. We have a very strong financial assistance program that significantly reduced out-of-pocket costs. It actually goes up to 500% of the federal poverty limit, and that helps for the uninsured and underinsured to ensure that access to treatment is not determined by financial circumstances. We try to remove that barrier at all costs to ensure that people are able to get access to their specialty medications really through our 340B program.
That's great, Scott. Thanks for getting us started. And it's really great to hear about even some of the work happening in Santa Barbara. Samir, I want to come to you next to talk about the work that you and your teams are leading in Chicago.
Yeah, hi, Allison. Thank you. And it's a pleasure to be here and as part of this webinar. I would say Sinai, my name is Samir Shah. I'm the president of Mount Sinai Hospital, part of Sinai Chicago, which is the largest private safety net health system in Illinois. And, one of the things that differentiates Sinai has been over decades is the infrastructure built around addressing healthcare inequities. And I really, put that in a three-part model. You have the hospitals like Mount Sinai Hospital and Holy Cross Hospital and the ambulatory network that's there providing clinical services. And then we have Sinai Urban Health Institute, which is the research arm that really researches disparities in our community. We go into our communities and understand the inequities and more importantly, identifying the root causes and then determining some sort of targeted interventions that could be presented in our clinical model. And then finally, as we know, with inequities, a lot of the care and inequities, the solutions are further upstream than the four walls of the hospital. And that's where Sinai Community Institute comes into play. It's our community outreach arm, and, focusing on things like food access, housing access, social and workforce needs, people, helping them identify jobs. We service around 14,000 families every year, which is pretty amazing. And finally, I'd say the one, unique model is that we've integrated and embedded across all of this is our community healthcare model, community healthcare worker model. And we have embedded community healthcare workers in many of these key service lines to work closely with our patients to better understand their social determinants, whether it be transportation needs, food or housing insecurity needs, and being able to partner with them to get the access they need to improve their overall health. So I think that design is something that we're particularly proud of, being able to take care of patients within the four walls and then reaching outside of the four walls into their communities.
Absolutely. Thanks for getting us started. Brandon, want to come to you to round out this first question to talk a little bit about the ways Clearway Health is supporting our hospital partners in their communities.
Yeah, thanks, Allison. Good afternoon, everyone. I'm Brandon Newman, CEO at Clearway Health, and thanks for the opportunity to speak today. Just to tell you a little bit about Clearway Health and what we do and how we're helping Scott and Samir at Cottage Health and Sinai today. What Clearway Health does is we partner with hospitals and health systems to help patients access expensive and difficult to manage medications. And part of that being through copay assistance and also through free drug programs. And we help them qualify in a compliant way for these programs, which is really important, and help them qualify in a quick way so that once they're prescribed the medications, they can get started quickly. And what we find with this model that we have with pharmacists and liaisons embedded at our partner health systems is that the more expansive the education that our pharmacists and liaisons on site are able to provide for some of these really high cost medications, it makes a huge impact on improving access to care. And so the concepts around access, affordability, costs around these specialty medications in marginalized communities are just really important here.
That's great. I think it's going to be a great conversation to dive into more of these community impacts and the ways that each of you are serving the communities where you are. Our next question will help us to do that. And Samir, I want to start with you on this one to talk more about those community programs. You talked a little already about some of the community healthcare workers and other parts of the organization, but what are you most proud of in the ways that Sinai Chicago is serving your area?
Yeah, no, thanks for that question. There's a few things that we're really proud of, and most recently, I would really want to highlight our public-private partnership mixed-use development called Ogden Commons in the North Lawndale community, which is right on the campus of Sinai. And when we talk about health inequities, one of the things our Urban Health Institute identified as one of our top leading causes of issues within our communities is housing insecurity, access for our communities to have safe and affordable housing. And that kind of trickles down. You don't have safe and affordable housing, you can't afford that. Well, guess what then? What comes as a consequence or a risk of that is you don't have enough funds to pay for your medications or your food that you need, the healthy food that you need. So what we've done is partnered in creating about 300 new units. Right now, I think about half of that is built and it's fully, people are all living in there, and community members are moving in, and it's a really high demand, and we're really excited about that. We've been able to also add retail, so restaurants as well as a bank, which is important for a community to thrive. And finally, Sinai's been really integrally involved in developing the clinical programs there. So a lot of preventative care, digestive health, which is also a big area of our specialty pharmacy, is growing within this area as well, along with maternal fetal medicine programs and a lot of things that are needed within the community. So we're really excited about that development. I would add another one is a robotic surgery platform. In the past few years, we've increased our robotics platform with Da Vinci robots and Senhance platforms. And when we think about equity in general, we want to be able to offer these innovative opportunities for surgical patients to improve their overall outcomes as well. So being able to expand that has been a big win for us. I think we're one of 3 centers of excellence for minimally invasive gynecological surgeries, which we're excited about. And then I would just end with access. We've been, over the past few years, adding access points across the system, things like infusion centers, diabetes centers, dialysis, behavioral health centers. I think all of that access points are important. As we all know, the closer you get to care within the community, the better outcomes are for our patients. So I'd say those are the key ones that we're really proud of.
Samir, let me ask you a quick question. How far is that housing complex to your main facility, or maybe to your specialty pharmacy?
Across the street. It's literally on campus. So
do you do delivery straight to the units?
Well, yeah, we started home delivery. So, yep, we're able to deliver anywhere around our service area. So it's been really nice. And even the retail pharmacy, because it's not even specialty retail, it's a huge shortage here. So having patients be able to kind of come and see our retail pharmacy for their maintenance medications has been great as well.
That is great. I know one of the things, and Samir, you've talked about this often with your team, is not only how you're supporting the community and providing some of those solves for the social determinants of health gaps, but related to solving for the pharmacy and specialty pharmacy challenges, where you have many retail chains that are closing, and you have providers who have relied on them, certainly patients who have. And so being able to solve for so many of those gaps in care, including home delivery or coordinated delivery, is such an important part of that continuum of care.
Yep, absolutely. And I think we're seeing a significant amount of closures around us from a retail standpoint across all of Sinai's service areas, and it's concerning. So for health systems, have to think about the whole medication access opportunities for their communities. As we see more closures, the community members are going to be relying more on us to make sure we're able to get them their medications.
Well, thank you for let's come to you to talk about some of the proud moments of the work that you and your team are doing in San Diego.
You know, I think at Cottage Health, some things that we're very proud of is
Hey, Scott, I wanted to pause you. I think we lost your audio. If you'll back up to the proud Cottage Health moments. Now we got you.
Sorry, technical difficulties here.
No worries.
So, you know, we're so proud of our pediatric specialty network within Cottage Children's Medical Center. And we have over 20 different pediatric specialists. And we treat families across the Central Coast in highly specialized care rather than having to travel sometime for a full day if they need to get care in the LA market or up in the San Francisco market. And how we connect our patients with the use of our specialty pharmacy network is very impressive. And the work we support for our patients with chronic conditions, such as those unfortunately with HIV or cystic fibrosis, MS, or other immunological conditions, we really try to ensure we have great connections and we help patients understand and manage their treatment plan. We also have some community health workers, we have navigators, and we really try to make sure that we provide as much resource as possible to the patients and the families that we serve, and really try to improve the continuity of care. And the thing that we anticipate is we're seeing a heavy reduction in the use of emergency room visits for what we would call chronic care patients, that because they adhere better to their medication management, and also reduce readmission. And so our goal is very simple, to make sure we provide the right care in the right setting while we keep our patients connected to the resources that we provide them, and remove as many barriers as possible, whether if it's a financial barrier, if it's care coordination, or even kind of like what Samir just said, also do home delivery, or ensure getting access to their medication is something that's not a barrier for our patients.
That's great, Scott. You all have also done so much, especially in the last 18 to 24 months, around ambulatory expansion. I can only imagine that's driving the improved access points, where you are reducing ED visits, you are reducing readmissions. And so will you talk a little bit about what that ambulatory investment has meant and the outcomes that it's creating?
Yeah, so we're really growing our Cottage medical group. And we kind of, again, I said we serve a very large geographical footprint, all the way from Ventura County, all the way up to what they call San Luis Obispo and the whole Santa Barbara County. And to ensure we provide the right level of access for not only primary care, but also specialty care. So to really remove that ability to make sure we're at the right locations for the people we serve. And we've recently expanded our specialty pharmacy and our specialty pharmacy network. One thing that we've seen is our county system has reduced, because of the implications of HR 1, reduce access to pharmacy and other things. So we've kind of picked that up, and it was kind of like what Samira was saying. We're actually starting to see some of the larger retail pharmacies close in our region. And you go to one of the big box retail, and there literally could be a line out the door for people waiting to get their medications. And for a lot of people, that's a big deterrent. And here we're able to do everything from when you're in the emergency room, we do meds to beds, we have access to our specialty pharmacy on site, we do home delivery. So we have a much better coordination to ensure people get their medications timely, and to make sure that we do whatever it takes to make sure they're compliant with their use of their medications.
Really great. And, you know, I think it's that access point that each of you have talked about in so many different ways. One of the things that I thought about as you both talked, especially around ambulatory expansion, is something that each of our organizations have had respective conversations where, as you're looking to add especially specialists and you're looking at how to improve that specialty network, oftentimes as you're going through that ROI, it is certainly what is the need of the community and the patients that you are serving and the care that they demand. It is also the financial value proposition. And so many times organizations look at the clinic visit and the procedure visits and the fees and the dollars that come from that. Both of you are in a pretty unique spot where specialty pharmacy is another incredibly big consideration, because you have the specialty pharmacy opportunity where you're able to serve patients, buy those drugs at 340B prices, and then reinvest that back into this continued expansion and access the work that you're doing. So just appreciate the perspectives and commend the work that you're doing. Brandon, want to come to you last here to talk about what you're seeing across client organizations that we're supporting and partnering with in other places across the country.
Yeah, thanks, Allison. So many things I'm proud of. I'll maybe mention a couple that I think really kind of stand out and span across many of the organizations that we work with. At Clearway, we're so proud of the way we help close gaps with social determinants of health, and just health literacy and medication literacy, and just a good understanding for the patients and parents to know what it is that they or their family members are going to be taking, and really understand that we're going to be there to help them through this journey if they have questions that come up. And Samir, one thing I noticed when I walked through your clinics at Sinai and spoke with some of our pharmacy liaisons that are embedded there, is I was really impressed how they are part of the community. Oftentimes when a patient has to use a specialty pharmacy, they're talking to someone over the phone that may be in a completely different part of the country, and sometimes it's just really hard to be able to engage and relate. And I was really impressed with not only are they part of the community, your liaisons, but how you have bilingual representatives there that could just really engage with the patients and have good quality conversations, without having to have a translator, and help close some of those gaps. One thing that I would say that I'm proud of, and some successes that we've seen across some of our partner sites as well, would be helping with new treatments that address some of the population health initiatives. And the way we can do that is we can look for clinical markers within the EHR to determine patients just as soon as these drugs come out, or if we know when it's going to be coming out, to figure out who would be a good candidate. And we can use that data to help empower the providers to be able to prescribe some of these, potentially life-changing medications for the patients. So, there's new drugs hitting the market every day, and just helping our partners find a place for those is really big. Another example I would give is with some of the clinical initiatives that we have, and I'll tell you one that I'm proud of, is this example will be with Cabenuva. Cabenuva is for patients that have been diagnosed with HIV. And you may have seen some commercials about it, but, this is a once every 2 months dosing regimen. So obviously a much more convenient dosing option for patients rather than daily pills. And what we find in these patients is that when they have more convenient dosing options, we see better adherence. And when you have better adherence, leads to and promotes better outcomes. And you see more patients that have undetectable viral loads, and really just helping prevent the spread of some of these diseases in the communities is really important. So the landscape's changing fast. There's a significant number of drugs in the pipeline that represent both new diseases and also just better treatments for with medications that we've had that are growing a bit stale, or maybe have some adverse effects related to those. And there's new cleaner drugs, so to speak, that are coming out. And what that means is not only the ability to take better care of patients, but also an increase in revenue dollar opportunity. So for the health systems, as you're looking at ways to pull these treatments in, the really unique connection point where clinical care and quality is first, it's pretty unique, and that has an impact on not just clinical care, but the operational and financial improvement for the systems as well. So those dollars can go back to things that Scott and Samir are mentioning, and taking care of their community. What we see often is prescribers know that these medications that are either on the market today or the ones coming, they're really expensive. And a trend that we found, especially in some of these underserved areas, is they think that these drugs are probably not a possibility for their patient populations, and they know access is tough. They have limited, nurses, that are able to spend hours upon hours to access these drugs. And what they're finding is that, when they have a partner to help with that, medication experts, that's really not the case. If you have the right resource, the right partner to be able to access those, it's possible for these patients to get the drugs that they need. And, it's just really good for the patients, and just a really good thing to see in the community.
And just to add, one of the things that we were really excited about when we started this program, you're spot on. I think across a lot of our physicians had a lot of burden put on them for all these prior auths, and especially the nurses as well. And you would see piles of them, sitting on their desks. And clinically, that's a problem, because for a patient, we want to get them access to these medications as quickly as possible, right? So when we went live with this program, I think within months, we had turnaround times of about 48 hours for prior auth approval, which was amazing. That translates to improved outcomes, and patients being able to take their medications. If you're a patient or have a family member, that's dealing with a significant issue, you want that medication right away. We see it, and our teams do such a great job of being able to improve that turnaround time and obviously educate the patient on how to take those medications. But what our clinical teams are proud of is that the patient's outcomes are going to exponentially get better with adherence.
That's great, and a huge success story too. When you have a program that drives all of these incredible impacts and the clinical quality and the other financial and operational outcomes, pretty significant deliverables that are tied to that. It's a really good lead-in, I think, to the next question. And Samir, if you'll talk a little bit more about this, you have a hospital who is serving an incredibly underserved patient population who relies deeply and desperately on the savings from the 340B program to continue to care for the patients you serve. So what has the 340B program meant for Sinai Chicago and the work that you're doing?
Yeah, no, I think the biggest impact has been access and also making our service lines more comprehensive. I think those are the two most important things. You can have all the innovation in the world. Pharmaceutical companies are creating some amazing therapies and treatments. And if your communities don't have access to it, it's not a good feeling for all of us as leaders. And I know our physicians are feeling the same way. So one of the things we've been able to do is just improve that significantly. And that's been a great story. I'll give you an example, like our GI, digestive health service line. We have a really amazing group of physicians and clinicians on that team. We're doing a lot of preventative care, cancer prevention through colonoscopies and at a very high rate. But one of the concerns from the team was a lot of inflammatory bowel disease patients were coming through our ED, and they were coming through with significant issues. And then they would send those patients elsewhere to go get treated. And those patients would end up right back in our EDs. And it goes back to those social determinants. It could be transportation to and from somewhere further away. It could be just care navigation. It's complicated to go to all these different specialists in different systems where they trust Sinai. They trust our physicians in our ability to care for them. So with this program, we've been able to add inflammatory bowel disease clinics, so IBD clinics. We've been able to add fatty liver disease clinics. We've been able to add weight management clinics. So holistically, patients are being able to be treated with our physicians at Sinai. And that's been a game changer, and we're hearing a lot more stories about remission and treatments for our patients because the therapy is there. We're able to deliver that therapy. And it really increases the satisfaction of our physicians as well. And our patients, obviously, with those, we see those rankings that get pretty high with patient satisfaction as well. One of the things I'm particularly proud of is also for a safety net health system, we're at, one of the things we're trying to do is to remove inequities is to create care teams, multidisciplinary care teams that are very, very strong. So the burden isn't just on the physician or the one nurse. As you know, many of our patients require so much more work and help. So being able to add those community healthcare workers, liaisons, navigators within a care team of any service line is really a big lift up for our services. And we've been able to see great outcomes through that. Embedding pharmacists in these clinics is important. It's ideal. If you're able to embed pharmacists with the physician, that gives the physician more capacity, obviously, to do more. But medication therapy is enhanced, adherence is enhanced. So I'd say we've been able to lift up our care teams and make them a lot stronger to deliver on these service lines, which has also been something that we're really proud of as well.
I have to say, if anyone's listening and wondering the definition of what the 340B program should be doing, that's it. It's the reinvestment of elevating and providing equitable, accessible care. So really exciting to hear you talk about that work.
I would even add one thing. You're spot on, Allison. Like some of the things that in order to grow certain service lines, we have to break even or make more money than we lose. You cannot just operate in this environment, high quality service line, not being able to, afford. You got to make more money than you spend. That's how service lines operate. And this specialty pharmacy not only lifts up quality and outcomes, it does generate the savings that are able to put back into the service line, so that we're able to operate something we're very proud of. And that's been a big game changer for us.
Yeah. And congratulations on the pathway to do it. Scott, let's come to you and talk a bit about what the 340B savings have meant for the Cottage Health organization in your community.
Well, for Cottage Health, the 340B program is much more than just a pharmacy program. I think as Samir has indicated, it really helps us support that continuity of care and specialized services that really individuals in our community can't find anywhere else. So again, those savings that are generated with the 340B program allows us to invest in programs, as you said, have pharmacists in the clinics to be able to provide those access to strengthen care coordination through navigation, our community health workers, and really to be what we've always intend to be, is to serve everybody in our community regardless of their economic conditions. And so those investments help us to sustain all of those programs, whether pediatrics, chronic care disease management, some of the specialized programs such as our high-risk OBs, really to continue to be able to serve within our community. 340B is an essential tool for extending care to patients who might otherwise face significant barriers to access. One of our biggest concerns is all of the news in Washington that everybody has concerns about. And if you look now through the changes of redetermination and enrollment every 6 months and all the things that are coming through the HR 1 bill last year, we're going to start seeing people that have no coverage at all continue to probably climb in every market across the United States. However, when you go back to the Affordable Care Act, when that got legislation approved and start people getting access to care, the specialty pharmacy world is so much different back then it is today. And the reliance on 340B programs to serve our communities is more than essential. It is really the safety net pharmacy system that has now been built as some of these very large big box retail with specialty pharmacy and some insurance owned, they're actually retreating backwards. So we want to make sure that pharmacy and specialty pharmacy doesn't become a desert out in communities across the country. So it is more than essential for many communities.
Absolutely. One of the questions that just came in is talking about the critical element of documenting and reporting how you're reinvesting those 340B dollars, and then how you're documenting that. I know one of the ways that Clearway Health partners is to really help with that 340B impact, and how you're calculating and able to share the ways that you're reinvesting in completely compliant and necessary ways. If either of you have thoughts on what that looks like for either Sinai Chicago or Cottage Health, would certainly love to share that based on the question from the audience here.
Well, I'll start real quick. Just from a Cottage Health perspective, we're not a huge system. So we don't have the level of depth that Clearway brings to us to understand the rules and regulations, but then the analytics and the knowledge that you would get regardless of any size of a health system across the country. And so we're able to tap into that expertise to make sure that we're not only regulatory compliant, but we're compliant on the reasons of why we're a 340B facility. And we can tell story after story and document everything because of the systems we put in place.
Yeah, and I would just add to that, we have a team that keeps a very close track on all the reinvestments with the program with regard to actually people that we're reinvesting back into, whether they be pharmacists, liaisons, also charity care. We're the top 5 charity care hospital in the nation. And one of the things that we do with the 340B program is for patients. And I didn't mention it too much before, but Sinai takes care of a significant amount of probably the highest in the state and maybe one of the highest in the nation in terms of Medicaid, as well as underinsured and uninsured individuals. Those uninsured individuals, we have to care for them when they come through our door with the highest level of quality as well. So we do extend these prices to those patients, and they're able to get the same care as an insured patient versus uninsured patients. Medication access is a big part of that. I'm really proud of the fact that we've been able to add that service as part of this specialty pharmacy program where, whether it's uninsured or underinsured or insured, access is available to them through whatever mechanism is found, whether it's a manufacturer discount program or we're using our 340B price to extend it to the patients and helping them pay for it. So there's a lot of opportunity there that we take advantage of to make sure everyone gets the care they need.
That's great. Thank you both for taking that a step further. And for the group, thank you for the question. Brandon, want to come to you because so often we talk about access as a key driver of the specialty pharmacy programs and certainly optimizing the 340B component of that. Talk a little bit about the things that you see as we look across the client organization and the work that Clearway does.
Mm-hmm. Yeah, thanks, Alton. So there's a lot to unpack when we talk about access. And when we're talking about expanding access and closing some of those gaps, what does access look like for patients when they leave the 4 walls of the hospital? Scott commented a little bit on, the big box pharmacies, the retailers, the independent specialty pharmacies, PBM-owned specialty pharmacies. Oftentimes that's a blind spot whenever the medication component is such a big deal of, the patient's treatment and their outcome. And when you lose visibility of that, things just fall apart. That's what we see so often. And something that's kind of staggering to me to hear is oftentimes when we partner with the new health system and we have the opportunity to just kind of talk to and interview some of the providers and talk to them about their experience with specialty pharmacies and their patients taking these specialty meds, they oftentimes have no idea what happens once the patient leaves their appointment and they write that prescription. So they send it off to a pharmacy. They're not going to talk to the patient until they come back in, and 4 to 6 months, probably best case scenario. And so they have no idea if the patient ever got the medication initially. Did they stop taking the medication? They just don't know. So they lose full visibility to that. And that's a big handicap that your providers face with your patients if they don't have an in-house specialty pharmacy. And so thinking about those touch points that having an internal specialty pharmacy offers, we're talking about these patients or talking to the patients very frequently between all their encounters with the provider. So we're doing check-ins clinically, we're calling to schedule their refills, and we're documenting all that so the providers can see, so that when a patient comes in for a follow-up, they can see, oh yeah, patient got the medication 2 days after I prescribed it. They've had 3 refills. They had some side effects, but the pharmacist helped them work through it. That just gives so much better visibility to what they would have had previously. So I think that's a really big component. And another thing that we're doing that I think has been really effective is some efforts around digital engagement. So sometimes when patients fall off and you don't hear from them, and it's tough to get in touch with some of these patients, you can't get them on the phone. So instead of playing phone tag, we have some mechanisms now where we're able to collect patient reported outcomes through some text messaging, some push feeds, to see how they're doing, and the medications are tailored to whatever disease they have or drugs they're taking. And we can see how those patients are feeling and, how the medication is performing for them. So, we have the ability for them also to schedule their refills at their convenience. So when we're calling them, it may not be a convenient time, but if they can click on a link and be able to schedule their refill whenever it's convenient for them, we're finding that really leads to better adherence. Patients are going less days without therapy. We see an improvement and their adherence calculations with medication. And so we don't see these gaps from missing the meds, and ultimately better outcomes are a result of that.
Absolutely. On this topic, we've gotten several questions. I'm going to put another one in here for a bit more discussion. It is certainly not a surprise to the panel that a question came in about the potential reform of the 340B program. And so I'll tee this up a bit and then would love thoughts from the group. A year ago or more, we heard about the rebate model pilot program for the first time. Everyone scrambled to prepare for a January 1 of 26 start, then was put on hold. And then now, just several weeks ago, have now heard about the intention to begin that rebate program January 1 of 27. We take that and layer it with the impacts that we're already feeling from both IRA and MFP changes. And so altogether, we look at a lot of questions that we hear often, which is, how is this going to impact it? Are we concerned about the future of 340B? How do we plan for these changes to make sure that we are best positioned to be successful? And so many of the conversations that we have with our partners and prospective partners center around those questions. What I'd say as a jumping off point for this group to take is, we're doing the modeling and the planning to help anticipate for that impact. And so when we look at things like the financial projections and forecasting, we bring in also the drug pipeline and the opportunities that it creates for growth. We look at conservative estimates for growth to make sure that we're planful and good stewards of the business in the way that we're planning for growth. And then for impacts for things such as the rebate model, talking about the buying down of drugs in advance and making sure that we have, the plans for cash, the resources, oftentimes requiring headcount to do more of that revenue cycle type of work that has not historically been a specialty pharmacy focused part of the business. And so all of those are things that we talk about. Would love to hear any thoughts and perspectives. Certainly, I know in Illinois has had some recent news tied to this, Samir, and then Scott from you and Brandon too. But Samir, any thoughts?
Yeah, no, I think ultimately the most important thing is we have to keep our eye and focus on patient care and making sure patients have access to these medications and really working closely. A lot of these new items are going to add administrative burden on health systems and particularly safety nets who don't have that capabilities right now or FTEs to handle all this, and we'll have to make those adjustments if and when they do come down the pipeline. We are concerned about the cash flow implications with the rebate program. It's just adding another third party into the mix, and ultimately what happens is the patients are the ones that are going to get harmed, and it's our job as a health systems and to protect our communities. So we're going to do whatever it takes to make sure patients continue to have access. I think the key that we've been talking about is let's continue to make sure we look for opportunities across the system that we can take advantage of and help patients that are things that we haven't necessarily got involved with in terms of other service lines to increase our ability to care for our patients. But yeah, we're really concerned about it. I think from an advocacy standpoint, we do have to talk to our, like a lot of our aldermen and senators and congressmen and women and figure out a way so they understand how much this is going to impact safety nets. And we're going to have to continue to explain that to everyone before these policies are actually enacted. I know the rebate model has come once and then it kind of went away, and now it's coming back. And I think these conversations need to come back, and we need to get real about letting people know how this is going to impact patients, how this is going to harm patients. That's ultimately what it is. You don't have access to medications. You're not going to be, your outcomes will change. And we have to kind of continue to focus on that as a group.
Thank you for perspective on that, and certainly I think critically important to stay aligned, both at the state level and the federal level. And look to more information coming soon to plug into on some of those changes and how to best prepare for it. So thank you for that, Samir. Before we get into our last planned question for the panel, another question came in that, Scott, you actually started with the comment that Cottage Health has served that community for 135 years. Samir, will come to you in a second, but the question really centers around, as the numbers of or underinsured indigent patients increase in an even harder socioeconomic environment, how is the health system changing to best support that? I think you all have talked about things that tied to that already, especially related to expanding access to care and specialty pharmacy. But talk to us a little bit about how your systems are adapting to meet the needs of those patients who have lost their traditional sources for support.
Well, if we go back in, again, our 135-year history, it wasn't more than just a decade ago that we really started to integrate into the community, really through the work we've done within population health. And now I think the use of technology, the electronic health record, all these other different avenues, we have a lot more sophistication about how we treat the whole person, not just treat the acute issue that might be at hand that shows up in the ER or might be in an inpatient bed. And we are truly now, I think, not just Cottage, but a lot of health systems are truly health systems. And that care coordination is essential. And then working with community partners, predominantly on the social determinants of health, and ensuring that you put the right resources to the right issue that's at hand for an individual. We say it all the time here at Cottage, we don't have to control everything, but we sure better know how to coordinate and better understand really what resources are available so we can do really nice handoffs with our other community partners to ensure that person is getting the care that he or she really deserve. And more importantly, to try to make sure that they have an understanding about how do they take care of themselves so that then those access points don't become so essential through the emergency room, as an example. So it's been fun to see the changes in how organizations such as ours really work in collaboration with community partners.
Great. Samir, anything you would add?
Yeah, I would add, it's a lot of uncertainty, as we all know. I mean, we see what's coming down the pipeline. I agree, continued focus on preventative care and optimizing quality and patient safety for our patients is still number one priority. We are putting a lot of work in our redetermination process. So as potential HR1 implications come down the pathway, we want to make sure our communities have the navigation to help them with the increased number of Medicaid redetermination. They're going to have to do it twice a year now, right? So we're going to help them fill out that paperwork and also that work requirements. I mean, there's a lot of administrative burden on our patients in our community, so we want to make sure we help educate them to fill out that paperwork, right? So they maintain access to Medicaid. I think that's going to be that's a big project for us, and we're underway with that because we want to. One of the big deterrents is if they don't fill it out, they'll lose their insurance, and that's not a good thing for our communities. So that's one big focus for us. Being cost effective is going to always been our focus, but we're paying very close attention to things like how do we provide the best care at the lowest price point, right? So how do we get improving our lab utilization, pharmacy utilization? We're diving deeper into that imaging utilization to make sure we're providing just the right amount of services, no more, no less, to improve and keep outcomes at the highest of levels. So our clinicians are working very closely to optimize that as well. And then finally, revenue cycle. Whatever care we're delivering, we want to make sure we get paid for it. And there's a lot of work from our end there to make sure we're getting paid for the services rendered.
Absolutely. Thank you both. And thank you again to the audience for the question. We're going to move into our last planned question for the panel here, and really looking to each of you to offer that piece of advice to the folks that have joined today when you're thinking about how to optimize, grow, expand, or even start a specialty pharmacy program to serve your patients in your community. So Scott, we're going to come to you first for this last question.
Thanks, Allison. And first you have to think, you don't have to use the word long-term, I think midterm. And it takes time to get a specialty pharmacy system built and operationalized. But every day you don't think about it is a day you miss opportunities. And Cottage Health, over a short period of time, I think has really started to see the fruits of moving into a specialty pharmacy in collaboration with Clearway. And the numbers speak for themselves now, which is wonderful. But more importantly, it's really ensuring that people get access to the care that they need, especially related to their pharmaceutical services, specifically in specialty drugs. So my advice is to just leverage experienced partners and subject matter experts who can help you navigate through this very complex world while ensuring compliance and, more importantly, to ensure operational excellence. So a well-integrated specialty pharmacy is not just simply a pharmacy service. It's a very strategic part that improves patient access, enhances care coordination, supports physicians, and strengthens the overall health system's ability to serve that whole person. And, which I know as healthcare executives is really part of our ethos of what we do and why we do the work we do.
Thank you, Scott. Samir, your piece of advice?
Yeah, in addition to those great comments, I would say just start off with your strengths. That's really, every health system has very strong service lines that are really going in the right direction with the specialty pharmacy program. And I would start off with those. I would engage physicians early in the process. Talk to all of your key physicians and make sure that they're aware and understand why we're doing this, how this is going to make life easier for them and open access for their patients and improve outcomes. Once you have their buy-in, and it's really easy to get that buy-in once we explain the why we're doing this and the focus on patients. And then finally, I'd say know what you don't know. So have an idea of what are some of your gaps in this specialty pharmacy model that you may currently have in place right now. There's a lot of compliance involvement, regulatory, safety, and there's quite a bit of intricate involvement with all those tied together. But just know what you don't know, and then work to either find that internally or partner with someone. So that you can scale up pretty quickly. And what we've found is we decided to partner with someone, and it's been a great partnership. And we've been able to scale more rapidly than we would have on our own. And that was the number one rationale for doing what we did. And then now what we see is, access is up. Our program's growing. More importantly, patients are getting the treatments they need that in a safety net system they wouldn't have otherwise had access to. And that's what the game changer is. So.
Thank you. Brandon, we'll come to you.
Yeah, I'd say a couple of things. Number one, don't estimate the pace of the changing landscape and the complexity involved with it. And this would be not only with new drugs, looking at what's coming out, the pipeline with specialties not slowing anytime in the near future, which is a good thing. But then also 340B compliance, we touched on some of that, but I think just making sure that you have your T's crossed and your I's dotted is going to be really important. So make sure that you have the resource for that. And then secondly, I would say don't delay. Every day that you delay, and Samir mentioned it, I think it's about being able to scale quickly and do this quickly. And every day you delay, just thinking through your initiatives and your strategy around specialty pharmacy, you're missing out on that opportunity could change the way your patients and your providers experience specialty pharmacy. And you're foregoing the opportunity to be able to use the dollars generated from a program to reinvest in your patient populations in many different ways. And just being able to create that easy button, and I hesitate to call it an easy button because it's not easy to create it, but once you do create that, and oftentimes, that means kind of working with a partner to accelerate it, it makes a huge impact, not only for your patients, but for your providers too. We hear so much about provider burnout and, what they're facing, and also with nursing shortages. And this has been a big satisfier that we've heard from a lot of our partners as well, is that it's just made that experience so much easier.
Brandon, thank you. I will say this really to kind of close us out. First, thank you to our panelists, and thank you to those of you who have joined today or who are listening back to this recording. We believe entirely that a hospital or health system is the very best position to serve their patients and to provide specialty pharmacy services. And we are incredibly grateful, Scott and Samir, for your time today to join us in leading this conversation. If you have questions, you want to connect with any of our panelists, please let us know in the survey. The Becker's team has been wonderful in supporting us through this process, and we'll be sharing out more information after today's webinar. So on behalf of Clearway Health, Sinai Chicago, and Cottage Health, thank you for your time and have a great rest of your day.